Hi, Dr. Cheryl,
Uh,
and welcome. It's so good to see you.
Hey, Dr. Sean, it's so good to see you.
I,
Happy Wednesday.
Happy Wednesday. Yes, I'm really excited about the training that we have coming up. 10
Me
things
too.
you should know when doing therapy with Black women. But I felt like it was important that we take some time to kind of explain why we wanted to have a training and what people can expect.
Yeah, absolutely. Well, the why is our clinicians know with any population of people, there are nuances. And with people of color, and then specifically Black women, there are some special nuances that need to be addressed and then applied when doing therapy with Black women.
Yeah, absolutely. I love so let me give a little history. So some may or may not know that we've also published an article regarding the stressors that Black women have, as well as speaking at a conference regarding the stressors and how those stressors affect our health as Black women, because we know that we lead in some of those medical concerns, as well as when it comes to doing therapy, there are just some things that may get missed when we're talking
Right.
about a clinical assessment. And
Hmm.
so we have been collecting data for
Yes, we have.
almost 5 years, believe it or
Almost,
not.
yeah.
And from that, there were some things that I noticed that I am going to talk about on Saturday, but there were also some things that you noticed. And then when we published our dissertations, there were things that would come up. And so that's why we
Hmm.
to say, like, you know what, there are some things that are different when you're
There.
doing any population. There are nuances, and so in
Yeah.
order to be more effective, you need to be aware of those nuances. And I don't feel like we talk about those nuances enough
No,
as
we don't.
mental health providers, but we are trying to talk about them now. And right now, we're talking about things related to Black women and their mental health. So, why don't you tell me some of the things you noticed, and then I'll share some of the things that
Yeah, right. Well, so for example, and of course, you mentioned stressors. Well, of course, people have stressors, but it's the things that lead to the stressors when we are talking about people of color, and again, specifically Black women. So, for an example, when we're talking about Black women, um, one of the topics will, and I'm just going to tease our audience, but mother worry. Well, of course, well, most mothers, or maybe I should just say some mothers worry. But when it comes to Black mothers, our worry is a little different because we have this sense of our children are not necessarily safe.
Mhm.
They go out into the world, and more specifically, our Black boys and Black men, because of some of the things that happen in society in terms of policing, for an example, where they could be singled out. And so just when they leave the house, that you can just feel your heart, the palpitation, and you can feel that tension, and you know that you're becoming stressed. And so that's just one of the topics that we'll be talking about on Saturday. And of course, everything that we are going to share on Saturday is evidence based, it is scientific, there is data peer reviewed to back up what we will be sharing with you on Saturday.
Absolutely, absolutely. And I was thinking about, as you talked about mother worry, that first time they take the car when they get their driver's license.
Mhm.
Or if you send them away to school, if
Right.
they're in another
Mhm.
town. There's just things that have that increased sense of anxiety. And so,
Yes.
as you said, we're going to be talking about them. And then the other thing that I love, not only the mental health implications, it's just like awareness, and then what can we do about
What
it?
we can do.
Yeah,
Right.
as
Mm-hmm.
clinicians, what we can do.
Mm-hmm.
One of the
Mm-hmm.
things that stuck out for me was I'm calling it girlhood to womanhood. And
Mm-hmm.
when I looked into Black women, we all started out as Black girls. And so some of the things that you hear people talk about now is adultification and parentification. And so
Mm-hmm.
we're going to talk about what those things are and what that means, and then how we internalize that.
Mm-hmm.
Sometimes even with parentification for Black children in general, there can be a sense of positive or pride that comes along with, helping and
Mm-hmm.
supporting the family,
Right.
because of the interdependence and intergenerational families and things like that. So
Mm-hmm.
we're going to talk about that, but it also depends on how the child sees it. And I don't think we
Exactly.
talk about it enough. As you said, we have evidence to back up the things that we're going to be talking about and things that you can consider. And I know for me, it was I, work with all kinds of women. I
Mm-hmm.
have the opportunity to be blessed. My focus is on the mother-daughter relationship, so I see all kinds of women. The however, or what I'm learning from working with these women, is that sometimes there's things on general assessment forms or intake forms that do not
Want to
necessarily
address it.
capture,
Right.
right, that just doesn't bring in that information. It's not
Mm-hmm.
until
Mm-hmm.
you sit and you talk. But we're trying to work on a form to capture some of those things that
Right.
we've seen, that we notice, and that the evidence is saying, hey, you need to pay attention to that a little bit more.
Right. Right. Exactly. Yeah. So yeah, those are some of the things we're just giving a little tease, and we're encouraging you to register. Dr. Sean, I know you're going to share that information.
I
Uh,
am going to share
yeah.
information. So we're going to include a link. One of the things that I will say, by the time somebody sees this, the date may have passed. I will say that, but hopefully this finds itself on your timeline when you need it. And
Mm-hmm.
so there is going to be a link to the workshop that is going to be September 27th, 10 a.m. Eastern time. It is virtual for counselors, any mental health provider, and helpers. I've extended the invitation to coaches
Mm-hmm.
if they're doing life coaching and some type of personal development. You need to be aware of these things.
Yes.
Yes, you may not be able to do therapy, but you should be aware of the nuances and the
Mm-hmm.
evidence that backs why you want to have this awareness.
Right.
Also, for Black women in general, understanding yourself better and knowing that actually you are not alone, as
Mm-hmm.
well as like there is some science behind some of the things that you are
Mm-hmm.
experiencing, as we talked about mother worry, or when we
Mm-hmm.
talked about having responsibilities to help out the family. And so
Mm-hmm.
there are some things that you can learn as well. But if you are a clinician, we do have a continuing education, and I just want to share some of the learning
Yeah.
outcomes. We're talking about this because it is how to identify culturally specific factors that are related to Black women specifically, but in a therapeutic experience. We're also talking about being culturally responsive in terms of our strategies, and culturally responsive helps us to build a better and stronger therapeutic rapport. We're also asking you to evaluate your biases and clinical assumptions that you may have, because, as I say, our training that we've had in school did not
Mm-hmm.
teach us. We might have had a paragraph or a page
Mm-hmm.
about different ethnicities and nationalities, and as more and more people are coming, as I said, I have the beauty and the benefit to work with all kinds of people. You
Mm-hmm.
need to know and understand
Mm-hmm.
culturally responsive therapeutic interventions.
Right.
So I'm going to put a link where people can register. What else do you think the people
Well,
should?
you did mention we're going to also award those two NBCC CE hours.
I was starting to say that, but I don't think I finished saying that. Yes, the
Right.
training did.
But we are, you'll receive a, if you remain through the entirety of the presentation, then you will receive a certificate of completion and also two NBCC CERs, National Board for Certified Counselors. So we are an ACEP, which is an approved continuing education provider, licensed professional counselor institute. And so, yes, you can get 2 additional hours to add to your continuing ed hours.
Absolutely, absolutely. I love that we're doing that. We try to make sure that our trainings are culturally responsive,
Yes,
on time in terms of relevant and current, and listening to what our peers want
want.
in terms
Mhm.
of continuing education.
Do you think we do have something else upcoming? Should we maybe mention that too? That's coming up in October.
We can mention it, and I think we should do another video. I love
Right.
that we continue to talk about it. You know, if anybody's been following us for any amount of time, we've been talking probably for 7 or 8 years. Um, and Dr. Cheryl has a show on Facebook on Mondays.
Fridays.
Right. So is it once a week? How often do you do it?
Uh, excuse me, Fridays, on Fridays. Oh, we were on summer break, but starting October 3rd, which is a Friday, 7:30,
Okay.
I do Friday masterclass with Dr. Cheryl and Dana. Dana is my daughter,
All
and
right.
we cover all kinds of relative topics.
So there you have it.
So
We
thanks for the
also
plug.
and we have our licensed professional clinicians institute.
Hmm.
We are able to give out NBCC continuing education, and in October, going into
They,
November, yes,
hmm.
we're going to have something called Prepare, where we are working with counselors who need to pass the national counselors exam, and we've been doing that since 2011. And so that workshop is coming up. We usually have a fall and spring installment. Um, and as well as other things. So we're talking, it's relevant. People, we want to make sure people get good information, it's backed by science. And we also want to help emerging counselors because you're needed and it's necessary. So
Definitely. So
I always say stay connected.
stay
Um,
connected and
and
other also join professional organizations, that keeps you abreast of changes. Those national organizations and even local, they know what's going on in your state or nationally, and there are things that you need to know for your practice. Laws change, they change, they open up opportunities for us as well. So joining a professional organization, there are many for counseling, and there are others just for mental health clinicians in general. But you need to connect. And of course, on our Facebook page, we have the Licensed Professional Clinicians Network Facebook. So we invite you to join that as well.
absolutely stay connected.
Stay connected, and we'll hopefully see you on Saturday at what time?
10 a.m.
10 a.m.
Eastern to 12
Eastern.
p.m. Link is going to be down below.
Okay, bye.